you have ever had a child with a medical issue, you know the bills can add up pretty quickly, and many services may not be covered. So what do? Well, the Sullivans of Cherokee County found a solution. They got a medical grant from the UnitedHealthcare Children's Foundation. If you've never heard of that, don't feel bad, because neither had the Sullivans until they went looking for help. The Fox Medical Team's Beth Galvin has their story.
This grant program is designed for families who have private health insurance, but they have medical costs that are either not covered or not fully covered by their plan. So that's where this grant would come in and fill that gap. And for the Sullivans, it gave them a way to get their daughter the equipment she needs.
In a lot of ways, Kaycie Sullivan is a typical 2-year-old.
Running around, she takes ballet. She has temper tantrums.
But when Kaycie was still a newborn, her parents, Sydney and Matt Sullivan, noticed something was off.
We could tell she wasn't hearing. By the time she was 4 or 5 months old, she wasn't responding to sound.
Kaycie was diagnosed with hearing loss, and the audiologist recommended a hearing aid. But that's where the Sullivans hit a wall.
In Georgia, hearing aids are not required to be covered.
Sydney's a researcher, so she went online and started looking for help.
Because I knew we weren't the only ones who were stuck in this situation of insurance not covering what we needed.
They earned too much money for several grants, but then Sydney found UnitedHealthcare Children's Foundation's medical grant program. As a family of 5, they earn $125,000 or less, so they qualified.
I immediately filled out the application, and within 30 days we had the money.
This grant program is designed for families who, like the Sullivans, have private insurance. That's a requirement, but have gaps in coverage, says David Spurkey, a vice president at UnitedHealthcare.
Typically, it's things that may not be covered by their regular insurance, either a hearing aid, like we're talking about now, or sometimes supplies or equipment when the children get very complex medical conditions.
Kaycie's grant has a lifetime cap of $10,000, but the Sullivans can spread out their requests. This time around, the grant helped them pay the bulk of the $4,000 charge for her hearing aids.
She will need at least a couple more sets of aids before she turns 18. So we're using that ability to submit for another grant. But it is a relief knowing that there is, when it comes around again, there's help out there.
The UnitedHealthcare Children's Foundation medical grant program has several important criteria. Number 1, the child has to be 16 or under when applying. He or she has to be covered by a private health insurance plan, and there is an income cap. It's for a family of 2, a household income of $50,000 or less. For a family of 4, the cap is $100,000 or less a year. And for more information on how you can qualify, go to fox5atlanta.com, and I will also post the information on my Facebook page. It's Beth Galvin, Fox 5. For the Fox Medical Team, I'm Beth Galvin.